Hello, and welcome to today's Cuyahoga County and Board of Health media briefing. My name is Devin Gianetti, and I will be moderating today's briefing. We are joined by County Executive Armin Budish, Board of Health Commissioner Terry Allen, and Co-Director of Prevention and Wellness Ramona Brazil. As usual, we will begin with remarks from our county leaders, then have time at the end for some questions. With that, we will begin with Executive Budish. Thank you very much.
Thank you, Devin. Thanks, everybody. Let me begin by thanking our County Board of Health. Of course, Terry Allen, Dr. Heidi Gullett, and Ramona Brazil. And I also want to directly address the staff of the Board of Health. Please know how very much I and every one of us here in Cuyahoga County appreciate your efforts on our behalf. Not only are you handling this spike in cases, doing all the contact tracing and gathering critical statistical data, but you're also now beginning to deploy the vaccines that are going to save our lives. So the burden of work just is growing. I hear so many stories about the way that you've helped people in our community feel better informed and how you're providing clear guidance on what they should do if they have COVID or have been exposed. You're even delivering needed supplies to people who are stuck in their homes and don't have a strong support network. I really can't imagine where we as a community would be without such a strong and professional group of people. To be honest, I wish I could do more than just say thank you and provide you with the kind of financial support that we've done. I wish I could wave a magic wand and make this all go away. I think most of us feel that way. But this pandemic has been getting worse, not better. And while the vaccines are providing hope, we still have some cold, dark, dangerous months to survive. To that end, I'm announcing that our County Board of Health is extending the stay-at-home advisory until January 15th, 2021. These are critical weeks. We have to follow the stay-at-home advisory and all the other protocols. We know that they work if you follow them. I can't wave magic wands and make COVID go away, but I can try and make things better in other meaningful ways. We've worked with the Board of Health and Metro Hospital to fund testing in underserved areas, and that has so far resulted in more than 14,000 people receiving free COVID tests, and that helps protect all of us. Now, we're providing $1 million to Metro to conduct a COVID-19 rapid testing pilot program for essential public service workers and others. The pilot program has already started and is serving essential workers such as paramedics, firefighters, police officers, and jail guards. People who work in close quarters situations and often come in contact with the public. So if a firefighter comes in for his shift and gets a rapid test, he'll know within 15 minutes or so whether or not he's positive. This provides an extra layer of protection for all of our frontline workers. Tests are the bridge to the vaccine. We're fighting hard against the virus. We're also continuing to support people, businesses, and organizations who have been hit hard by the economic crisis. We're building bridges to economic recovery. The county has already released millions of dollars to support restaurants and arts and cultural organizations. That we've done over the past few weeks. Our original art support was $4 million, and the restaurant grant program was $1.25 million. We did what we could at the time, but we know the need is just so great. So today, I'm announcing that through the emergency purchase process with County Council, we are able to release another $500,000 for the arts and culture organizations, including for-profits and individual artists. These programs will again be administered by Cuyahoga County Arts and Culture and Arts Cleveland. Both organizations will be reaching out to the original round of applicants and providing grants to organizations and individuals who did not originally receive grants. I thank both Cuyahoga Arts and Culture and Arts Cleveland for their help. The response to our restaurant support program was tremendous. We had 840 applicants, and with the first round of funds, we'll be able to provide 120 restaurants with critical support to help them stay in business. This week, I'm pleased to announce that we'll add another $500,000, which will allow us to help about 50 more restaurants in our communities. So in total, we're able to help about 168 local restaurants. I want to thank Destination Cleveland and Cleveland Neighborhood Progress for their critical support in administering these grants. Next, I'd like to turn to our jail. As we know, the spread of COVID in congregate or group settings is getting worse and worse. Everywhere, all over the country and the county, we're seeing this spread explode. Unfortunately, our jail is no exception. As we saw cases spike in the community, we began to see them rise in the jail. It wasn't so long ago that I was able to come here and tell you that we only had 1 or 2 cases in the jail. Well, that's not the case anymore. As of yesterday morning, we had 295 positive cases in the inmate population and 56 COVID positive staff. Now I want to stop here and just think about those numbers for a minute. It's a lot of people. The reason this is happening is because the spread out in the community is, to be honest, it's out of control. We've talked about how what we do in our own personal lives touches others, and this is just a perfect example. The good news is that right now we have no hospitalizations of the inmates. Unfortunately and terribly, we did lose a staff member to COVID. Corrections Officer Gregory Clark Jr. died this past summer due to complications of the coronavirus. C.O. Clark was a valued and long-standing member of our corrections staff. He was a grandfather and a pastor. My heart goes out to his family and to all the families that are grieving lost loved ones right now. I'll say it again. The choices that you and I make are impacting lives and deaths of our friends, family, neighbors, and coworkers. We're still taking every possible precaution in the jail. PPE, testing, sanitizing, isolating, quarantining. Excuse me. We've been told we're doing as much or more than any jail in the country. Our testing protocol in the jail is extremely rigorous. Incoming inmates are tested the first day they arrive. They're isolated for 7 days and then tested again before they're either quarantined or put into the general population. We're doing whatever we can safely and responsibly to keep our jail population down, because that gives us more space in the jail for isolating and quarantining those who are sick. As of yesterday, our jail, which has the capacity of about 1,880, had 1,351 inmates. The amazing reduction in population is the direct result of hard, collaborative work being done by Judge Sheehan and the Court of Common Pleas, Judge Early and the Cleveland Municipal Court, County Prosecutor Mike O'Malley, the Public Defender, and our Sheriff. In fact, this group had actually reduced the population down below 1,000. One of the reasons the numbers increased above the 1,000 is because the Ohio Department of Rehabilitation and Correction, or the ODRC, was severely limiting the number of inmates we could transfer to the state prisons as required by law. Prosecutor O'Malley filed a lawsuit to get this resolved. And now we're able to, as a result, transfer inmates into the state system with a little bit more flexible restrictions, and the county lawsuit has been dropped. We're also taking other steps to stabilize and reduce the jail population. Our sheriff signed an order letting our municipalities know that we would not be taking in any new individuals from the municipal courts with misdemeanors unless they're domestic violence misdemeanors. We continue to work with the Bail Project to provide funds to help those who are unable to provide bail for themselves and who fit the Bail Project assessment criteria. while we are aggressively trying to reduce the jail population so that there'll be more space to isolate and quarantine inmates who are sick, we're doing so in a responsible way. The prosecutor, the judges, the sheriff, they're not releasing any prisoners who are violent and would endanger the community. I mentioned earlier the large number of staff who have been infected with COVID. Those absences are creating a staffing shortage. So to protect the inmates and our staff, Governor DeWine has offered to have 50 of the National Guard come help us. They started on Wednesday, and I can't tell you how much I really appreciate the support of the governor. It's been invaluable. The steps I've outlined to reduce the jail population are crucial, but we also have a longer-term plan. One that I'm pleased to say is getting closer and closer by the day. That's our new diversion center. Last week, we learned that the state capital budget has appropriated $1 million for the diversion center. Rather than having people with mental health disorders and substance abuse disorders ending up in the jail, we're going to be able to bring them into this new diversion center where they'll receive treatment and be stabilized, and then connected to community support services or longer-term care. This is the right way to treat people who are suffering and need our support. This center will open in the first quarter of 2021. We won't be holding another briefing until after Christmas. And I want to wish all of you, no matter your faith, a safe and healthy holiday season. May you find some warmth and positivity in the midst of all this craziness. And may you all be healthy. I'm wishing all of you my very best. Thank you.
Thank you, Executive Budish. Appreciate the kind words for our staff. You were kind enough not too long ago to do a video that we shared. You took the time to create for the staff, and it was at the time it was a great tonic for them. People have been working triple time for longer than I can remember, evenings, weekends, and they just keep coming back. I think they have front and center the people that they've always served and their commitment to service. And it's remarkable, it's inspiring, it's humbling, and I thank you for recognizing that. And I believe your public health acumen has only expanded. Again, I think you should have an honorary MPH degree for what you describe and what you've come to understand very well. So thank you for your support and for protecting the health of the public. So as everyone knows, I'm sure at this time, the governor reported on Thursday that we are at risk level 3 or red and remain red, indicating a very high exposure and spread in the community. All 88 counties remain at high incidence, and I believe only Richmond County remaining at level 4 purple. I want to pause to say that people should recognize that between red and purple is mostly a distinction without a difference in terms of what we would do differently. We believe we treat these both the same. A lot of the indication moving to purple deals with the number of indicators they have to continue to move in a certain direction for a 2-week period. But we are still on high alert, and we've been there for quite some time. Our positivity rate among those tested for COVID has remained alarmingly high in our community, and we need to pay attention to that. We'll talk more about that with the data brief in just a few moments. We've also averaged over 760 cases a day in suburban Cuyahoga County over the week of this particular brief, compared to 590 cases per day from the previous reporting week. Those are huge numbers, and if we bring the City of Cleveland Department of Public Health numbers in, that number is around 1,000 per day. Recognizing that for every case, there are 2 to 3 contacts that we see, you realize we have very, very big numbers, and this surge is still very, very significant in our community. We are now over 9 times the rate of high incidence as defined by CDC in the Ohio Public Health Advisory System. COVID-related emergency department visits have increased for the 7th week in a row, with over 1,700 visits this week and averaging over 246 emergency department visits per day. Our staff continue to triage cases and contacts to reach highest risk individuals amid this ongoing surge. As Executive Budish noted, our Board of Health joined other urban counties across Ohio in extending our stay-at-home advisory. All the data points indicate that we're still moving in the wrong direction. The advisory has been extended until January 15th, which is one incubation period for COVID-19, or 2 weeks after New Year's Day. Our current surge continues and warrants these additional steps to protect the health of the public. And we'll reassess the impact of the holiday season on community and congregate setting transmission prior to January 15th. For those who decide to interact with folks outside their immediate family over the holidays, which we discourage, a COVID-19 infection acquired now could take more than a week to be reported, depending on when you get tested. The median time that people test positive is 5 days after exposure, but it could take up to 2 weeks. A person who gets infected next week might not display symptoms for several days, and some may be completely asymptomatic, but they can still spread, as we know. Then scheduling a test and getting results back could take several more days. We have more testing than we've ever had in the community, and all the sites book up fast, given the current surge. So we won't begin to fully understand the impact of the holiday-related increases until the coming weeks. As we know, hospitalizations and fatalities lag cases by several weeks, and we're now seeing the heartbreaking reality of this surge with an average of over 5 COVID deaths reported every day so far in December. That's just for our jurisdiction in suburban Cuyahoga County. We know hospitals continue to be concerned about bed capacity and staff shortages due to illness from COVID, given this major surge across the region. Inevitably, we've seen data lags given the unprecedented nature of the surge and the explosion of testing. To compensate, hospitals have had to delay their medical care to make room for COVID patients, adding to the domino effect from this pandemic. The significant number of acute patients, staff shortages, and deaths have taken a significant toll on healthcare workers, and everyone is tired. Everybody here at the board is tired, and I know all of you are tired. But this is not over yet, and now's not the time to let our guard down. Given the continued surge, the governor reported that more schools across the state who were open for 5 days per week are starting to pull back because of the continued high level of COVID spread in Ohio. The White House Corona Task Force has urged the following for the holiday season. It must be made clear that if you are over 65 or have significant health conditions, you should not enter any indoor public spaces where anyone is unmasked due to the immediate risk to your health. You should have groceries and medication delivered if you can. The task force has also said that if you are under 40, you should assume that you will become infected if you gather beyond your immediate household during the holidays. Most likely, you may not have symptoms. However, you are dangerous to others, and you must isolate away from anyone at increased risk for severe disease and get tested immediately. And if you are over 65 or have significant medical conditions and you gather outside your immediate household, you're at a significant risk for serious COVID infection. And if you develop any symptoms, you must be tested immediately, as the majority of therapeutics work best early in the infection. When we talk to people in the community that test positive for COVID, the big concern we watch very closely, and the physicians will tell you, is this shortness of breath or difficulty breathing. We worry about oxygen levels dropping in the blood and it leading to a domino effect, a negative effect, a cascade that can have very detrimental health effects for folks. They can end up in the emergency room very quickly. And we want to make sure that people are paying attention to that symptom. It appears to be one of the worst, and it affects those over 65 or those with significant medical conditions the most, but it can happen to anyone. Celebrating in person with only your household members continues to be the right choice, and it's clearly the safest choice. You can save lives through your sacrifices this holiday season. And our personal choices on how we celebrate and interact in our communities has everything to do with what the punishing impact and the death toll from COVID will be in Cuyahoga County as we go forward. It's in our hands. Wearing masks and washing hands and maintaining 6 feet or more of social distance and regularly cleaning high-touch surfaces are well-known, tried, and true prevention measures. And they should be built into the holiday season as the default way of doing business. And if you're interacting with anyone indoors within 6 feet, wear a mask. If you have young people in your household who interact with friends outside the household, this becomes even more important when they move about the community and come home to you. And these actions you take today can save lives tomorrow. And there's help on the way, we're excited to tell you. We're very excited to tell you. And Director Brazil will discuss the current information we have so far on our role in the COVID vaccination campaign, which is before us. As we begin this long-awaited and seminal phase of the pandemic response and move to offense with vaccination, we still must play defense amid this major surge of cases. Defense being case investigation, contact tracing, and a range of measures that we take to try to mitigate the impact and blunt the curve. The present moment is piled high with mixed emotions for all of us. We're excited to begin the vaccination campaign and the promise it holds for a better future for our community. But the death toll and the overall toll of this pandemic has been devastating. And the grief from the losses among family, friends, and coworkers has been a heavy toll on all our hearts. The reverberating hardships of the pandemic that have ripped through our community have exacted a very heavy price, and they continue to do so. Please take a moment to pay respects to those we have lost and for the difficult period which stands before us and their family members until the vaccine is widely available. So what we need to do is to continue to please wear a mask. And at the end of the pandemic, we'll all have to ask ourselves an important question. What did we do to help? Did we do to protect our neighbors and friends and family? And all of us can help by taking a pass on holiday gatherings with people outside our household and following all the prevention guidelines. These sacrifices will tamp down this runaway COVID-19 train in our community, in our region. So with that, Jonathan, I'd like to transition to our epi brief. So we'll start at the top here in our brief. This is week 50 of what is the MMWR, or Morbidity and Mortality Weekly Report. And you'll look and see there in the brief the case overview. You'll see that we have total cases thus far, 39,198 cases, and that's for suburban Cuyahoga County. We have over now 60,000 cases occurring in overall in the county. Within our jurisdiction, approaching 2,500 hospitalizations, over 4,120 countywide. And you should know that we saw about 200 additional hospitalizations over this past week alone. And the death toll, these are our friends and our family members, and a lot of people that we talk to at the health department, a lot of people that folks in the healthcare industry are holding the hands of people as they pass in these difficult times. And also, tragically, there are people that die alone at home. And so we should take a moment again to remember them. And we also are happy to say that over 29,000 of us in the county are presumed recovered from the virus. We're seeing more cases reported from the previous week. And we had seen, again, about 5.6 cases per day so far in December on average. If we move down and begin to look at our case demographics, you'll see about 55% of us are female among those that are cases, and 45% male. As you look at our bar graph for the age groups, we've seen that high number of 20 to 29-year-olds sustained pretty much through the summer when we saw that surge in the summer. But we are seeing growing numbers, increasing numbers of those between 30 and just under 60, growing, increasing numbers of cases. And of course, at the far end of those bar graphs from 60 and up is where our complications and our fatalities occur to a greater degree, but we've seen deaths unfortunately occur at many ages, at almost all ages. If we move down the graph to look at the rest of the demographics under race, you'll notice that about 55% of the cases are white, about 24% African American, 13% are unknown and not reported, and a small percentage are Asian, and about 6% are considered other, which would include Latinx and other races. It's important to note that what we've seen tragically throughout this pandemic are the inequities and the disparities associated with outcomes. Just as we see with late-stage cancer diagnosis and higher rates of fatalities, we see with diabetes and heart disease and lead poisoning, we see higher rates in the African American community in COVID in the same way. African Americans are over 1.5 times more likely to be a case and over 3 times more likely to be hospitalized and more likely to die from COVID. If we look at the ethnicity report, these are self-reported data. About 34% of folks we have unknown, they have not reported their ethnicity. We have 64% have reported as non-Hispanic Latino, and somewhere in the range of about 2% as Hispanic Latino. You'll see that about 8% of these folks are healthcare workers in those pie charts, and about 25% have pre-existing conditions like diabetes or heart disease. But note that many do not, and that has dropped from 28% from the previous week. But there is an assumption that only old people who are older or people that have chronic conditions are at risk for severe complications. And I can tell you from calls I've had with people on the phone from the beginning of this pandemic, that is far from true. So moving down, you see what is still an amazingly stark curve, what we call our epi curve, our epidemiologic curve, that shows our cases there in these bar graphs in red since the beginning of the pandemic, which we started tracking cases back at the end of February. Going forward, and what happens is the data lag there at the very far end, at the other end of the graph with the high bar graph numbers there, is that data still comes in, so that some of those numbers are still being tabulated. But you can see in the middle of the graph, you see a bit of a bump. We thought that was significant way back when, where we were seeing 100 to 200 cases come in a day in our community. That was our surge between mid-June and mid-July. We then did see a drop after there was a statewide masking ban. But then we saw this huge surge, which continues, that followed, which really began in October and has extended until now. So people need to look at that bar graph and show that huge curve and recognize that we are far from through this. And until those numbers begin to descend, and not just they tend to descend, but not just for a day or two, but for a trend. All these numbers are not relating to 1 or 2 days. They tie back to following a trend, a consistent trend showing that we are moving in a direction that we can then feel comfortable about. And we're not there yet. So if we move down, you'll also see what we've been showing and tracking on a regular basis. And this gives us a sense of the trends, and this remains stable, proportionally stable across all of our zip codes. We work with our partners at the Cleveland Department of Public Health to track these data, and we report them to give you a sense, again, of our trends over time, and they remain relatively stable. Moving forward to the last page of our data, we've been watching this very closely. And so what you see there in the gray curve is the critical care beds. These are the ICU beds that we track closely. And so they are trending just a little bit down from where they were. And 85% of beds utilized is a very, very high number in our community. We know from talking with our hospitals, they've had to do some patient movement around to make sure that there is bed capacity among hospital systems in the region to serve those that need an ICU bed. We also see that in the blue, the adult regular medical beds are at about 76%. That's still a lot of beds that are being used. I'm happy to report that we also worry about flu this time of year, right? We worry about flu and having this knock-on effect, or having a double whammy of flu and COVID. And we're happy to report that our data is still showing that flu is remaining low, and that we're very fortunate that that's the case, because we don't need 2 major viruses circulating at the same time at great numbers. The one concerning factor too that we see here is the yellow line is that ventilator use is up. And these are folks that go into the hospital, they have complications, and they're having shortness of breath. It's not being resolved. And unfortunately, they get to a position where they have to use a ventilator in order to survive. And so we worry about those folks, and so we're tracking that use of ventilators to assure that there are enough in our community. And lastly, the orange line tracks pediatric medical beds, and that is trending down at 40%. Jonathan, if you take us down a bit farther, we'll go to the testing. And so as you look here, you'll see we track our testing, of course, across the community each week, working with our 3 hospital systems. Metro Health, the Cleveland Clinic, and University Hospitals report data to us. And you'll see this past week, almost 41,000 tests were conducted, and 22.7% of people were positive. That's down a little bit from last week, but that's still incredibly high. We need to recognize that's still incredibly high. And that gives you a good sense that this pandemic is far from over, that our surge is far from over. And we remember those days way back in perhaps September when our positivity rate was at 5 or 6%. Those days are long gone. We hope to see them again soon, but we're not there yet. Very, very concerning in our testing data is our nursing home information. Our nursing home testing positivity rate is at an astounding 19.3% this week. That is an all-time high. And Executive Budish talked about concerns at the jails. We're concerned about all the congregate settings, the group homes, what's happening in correctional facilities, and what's happening in our nursing homes. And these are the folks that are most fragile. And so that gives you an indication, a clear indication that what happens in the community moves into these congregate settings. They are not separate. They can't be separated. The virus doesn't distinguish. It doesn't care. It goes about its business infecting anyone it can. So that number is up nearly 5% higher than the previous week. So this is still a very serious period we're in. And even as we look forward to the vaccination and what it means for all of us to have a brighter day for our community, we're not finished yet. And we need you all to hang in there a little bit longer. And it is always darkest before the dawn, but the dawn we know will come. Before we go, I want to once again thank our incident commanders, Jana Rush and Ramona Brazil, for their work in this response. As Executive Budish noted, we've been at this a long time, and now we're playing both offense and defense, and vaccination is critically important, but we have to balance that with all of our case investigation, contact tracing, data analysis, call centers, media communications, and connections with our partner agencies. So we're doing a tremendous amount of work, and I'm very proud to be part of this agency. A key person in this work has been Ramona Brazil. And I want to take a moment to thank Ramona. She's incredibly bright. She's a true professional. She takes her job seriously. She's incredibly compassionate. And her leadership through this, and now embracing the vaccination work, which she knows so well, which is part and parcel of her being a nurse. It's in her genes. She has embraced the work, and she has taken this on and recognizes the promise it holds, even as we have to balance this, and she balances this with the other work we need to do. And that is the world we're in now. We've got to find a way to balance all this. And I just want to thank Ramona, because I honestly don't know what we do without her. So I want to thank you, Ramona, for all you've done. And with that, I'm going to pass the baton to Ramona to take us forward to talk a bit about vaccination, which is a brighter topic for us all. Thanks.
Well, thank you, Terry. It was unexpected. Thank you very much. I would like to talk about our efforts concerning our preparations for vaccination. We certainly are at a crossroads here where there is more tragedy and sadness that we will see from our high level of cases that we currently have and have had over the last month or so. But there's also more hope than there's been with the vaccine. that we've seen in almost the more than 9 months of this pandemic. And although we have been highly concerned about the numbers and increases in cases in nursing homes, we are also encouraged to see our first nursing homes start to receive vaccination. We are also encouraged to see healthcare providers being vaccinated earlier this week. I know for myself personally, when you're a nurse, you have a lot of nurse friends. So they've been posting on Facebook and stickers in their stories. And I mean, I think we're ready to have a party just because I know everyone is so tired and so passionate about their work that we understand that this is a turning point. And so, I have had a few people ask me about the vaccine, whether I would encourage them to get it when it's their turn, whether I would get it myself. And I understand, of course, the fear and skepticism of the vaccine, especially in some communities. And that is rooted in history and lived experience, and that can't be denied. The first person vaccinated at Metro Health was Dr. Sherry Williams, a critical care pulmonologist. And Dr. Williams is also a board member here at the Board of Health. And I remember early in the pandemic, she said to us, don't put providers in the position where we need to choose who will receive care and who does not. And at the time, those words for me ran deep and as a personal call to action and a call to action for all of us that we have to prevent that from happening. I also think of my friends who have lost loved ones, who had loved ones sick or hospitalized from COVID. And also of the thousands of people we've talked to over the last months. Their stories of being sick, in some cases of being alone and afraid. And also I've seen how it has gone through some families where multiple people have gotten sick and some have passed away. There's a very moving story in USA Today, the Malinowski family in the Akron area and their battle with COVID. And it really touched my heart. We have heard that story like that many times, but I just want to personally thank them for allowing their personal grief to be shared with the world so people can see what happens. So the vaccine is part of our way out of this. So my answer is yes. And especially if people work in a situation like a nursing home or a group home, if you live with someone who is going to be high risk for having illness, I would encourage you to also get vaccinated when it's your time. I know my father asked me about it, and he's 79. He's been in the house since about March, coming out for doctor's appointments, but that's about it. But he asked me, and I also told him yes, because, one day I would like to hug him again. And so, I know we've been disconnected from our families and our loved ones for a long time, and the vaccine is going to help us get back there. So at this time of high cases and trying to maintain case investigation, we are also beginning to prepare for vaccinating our community. And we do anticipate as a health department receiving vaccination supplies beginning next week. And we will also start our efforts at that time as well. Jonathan, can you pull up vaccination phase 1? Thank you very much. So this is coming from the Ohio Department of Health and the state, and we will be following this vaccination approach in our community. We'll be entering into the phase 1 vaccine campaign, and we've already seen that start to happen at the hospitals. And so we will be following this to prioritize what groups receive the vaccine first. And most of our long-term care facilities in the county have entered into a federal vaccine program that was mentioned before. So they will receive vaccinations from CVS and Walgreens. Our hospital partners are vaccinating healthcare providers, especially those who are currently working directly with people who may have COVID-19. On the public health front, we will be responsible for vaccinating EMS and also any other group living in a group home setting or group care setting that are not covered by those other programs. So we will be holding small and large points of dispensing clinics. We've been preparing for this since the summer. We knew that we needed to get ready for when the vaccine came. We did our back to school vaccine campaigns as well as flu vaccines in preparation for COVID vaccination. Actually, we've been doing this for years. If some folks remember H1N1, about 10 years ago, we had large points of dispensing or pods at that time. We've also been working with our partners, including our county emergency management, as well as our emergency operations center and local fire to begin vaccinating EMS. And we anticipate that that will go on through the end of this year and into the beginning part of next year. We'll also be working on beginning to vaccinate in those other settings. So just as a kind of a closing statement here, there is light at the end of this tunnel, and we have to maintain our public health efforts. While this is going on, there'll be an overlap of those things. So we have to make sure we continue to do social distancing, washing of our hands, and wearing masks. And all of the due diligence that we've been doing, we need to continue doing it and have patience as the vaccine begins to get more spread into the community. So I, like everybody else, am ready to say goodbye to 2020. It's been a very long year. So I wish everyone a COVID-safe Merry Christmas and a happy holiday season and a much better, brighter new year. And with that, I'll turn it back over to Devin.
Thank you all very much for your remarks. We now have some time for some questions. As a reminder, please identify yourself and your organization when asking your question, and please remember to keep yourself muted when not asking a question. So with that, we have some time for questions.
Hi, this is Anna Huntsman with IdeaStream. I was wondering, I have a couple questions about more details about the vaccine allocation that the county is getting. I'm curious if you know how many doses are coming next week, and if you have any more details about where people will get those vaccines, that would be great.
Right. Thank you, Anna. I'll give you a general overview. We've been in conversations with the state. We know that they've been discussing somewhere over 200,000 doses are going to be distributed across the health departments, about 108 health departments and 98 hospitals in the state for the Moderna vaccine specifically. So, there'll be weekly allocations of vaccine that will come forward, and those are being divided up according to there's sort of a social index that they're using around risk in addition to the size of the county and understanding populations at risk. So we should have a better sense of that going forward. And we're expecting vaccines sometime next week. As you know, this has been happening quite fast and furious. So we should know more, I think, certainly early next week, and we're going to be prepared to deliver that vaccine out. We know that the 1A populations include EMS, include long-term care facilities that aren't connected to the pharmacy program where CVS and Walgreens are assisting them. They involve home health. They include developmentally disabled populations. We know that they also include urgent cares and other physicians that are not connected to hospital systems. So the 1A group is rather sprawling, but the key here, of course, is that if we can vaccinate that 1A group and get that 2-shot series done with them over time here, we're going to significantly reduce in the coming months the risk for complications and fatalities, which is certainly great news for all of us. Great news for all of us. So we think those details are going to come soon. We've watched on social media and television all these healthcare workers getting vaccinated, and it's been the best TV I've seen in I don't know how long. So it's nice to see that happening, as well as now, just today, as Ramona mentioned, we're now seeing the residents and the workers in long-term care facilities get vaccinated as we speak. So we're moving forward. We've got a long road to hoe, but we're moving forward, and we have that sense that we know that the vaccine is our only way out of this. I know also We saw recently the Surgeon General, Dr. Jerome Adams, rolled up his sleeve as a demonstration of the need to get vaccinated. And so we know many physicians have done that to date, and we appreciate their leadership. And so I think that's kind of what we know right now. You may know, as Director Brazil noted, back 10 years ago, we were knee deep in the hoopla around doing points of dispensing, or pods, where we were dispensing H1N1 vaccine. And so we know how to do that. We have great relationships with our emergency operations centers, with our hospital systems, and with a range of partner agencies in the community, and our safety forces. So we feel good about that. And there have been a lot of people that are willing to support us to get this done. It's in everyone's best interest to do that. So we will expect to know more next week. And, a lot of this, as you saw, even with the hospital systems, we have these on or around dates when we're expecting things, and we're being told next week sometimes we should get our vaccine. And is our plan then to begin that process? And it will be a trickle, as they say initially, just because we know vaccine is being produced and disseminated not just here in Ohio, but around the country and frankly, all around the world. And we are amid an historic moment here, an unprecedented moment of vaccine distribution across the planet over time to protect everyone. And so we're going to embrace that sentiment and do the very best we can to vaccinate as many people as we can with whatever vaccine we receive.
So are you going to do like drive-up or drive-through clinics for people to go and get the vaccine, or will you be actually going to, say, the EMS place where people are getting it? Do you have any details about that?
Yeah, thank you for the question, Anna. So I think we're going to be taking several different approaches. When you have an infectious disease, you have to think about making sure you reduce risk. Back with H1N1 10 years ago, we were using gyms and schools where we did drive-throughs. People could come inside the buildings, of course, and get those vaccinations. So yes, we will be using drive-throughs for vaccination. We also will be looking at teams to deploy teams of vaccinators that can go out to places where people can't come to us. They may have a developmental disability or some other reason or purpose where we need to come to them. And so we're looking at a bunch of different approaches, but we would see both some drive-through settings that we're looking at, as well as some mobile teams. And that is exactly how we delivered. We had both the fixed site of schools and gyms and back with H1N1 10 years ago. And Ramona relates, we had teams, of course, reminded us that did, at the time we were concerned about younger folks, and we went to some daycares at the time because H1N1 was a big risk back then. So we would use both those approaches. And we have staffing plans and are working with some partners to get that done.
Okay, thank you so much for clarifying.
You're welcome.
Any other questions?
Yes, this is Pete Krause with Cleveland.com.
Go ahead.
Can you, this is a question for whoever. I was just wondering if the stay-at-home advisory that was extended, could somebody just kind of go over again the specifics of what that all involves?
Sure, I can talk in general terms about it. If you recall, that was passed a while back, and I have some language here that I can share some components of some of the components from. We passed it basically a while back, and we're re-upping that extension. So given the dramatic increases, we want to make sure that people are really only focusing on essential travel, and it's an advisory. It's not an order. We are asking people to cooperate. So we want people to take some steps to do the best they can to limit transmission. So we want to, from any public and private gatherings, for instance, meetings or social events occurring outside of residence should be limited to no more than 10 people. And we see that as applying to both indoor and outdoor events. It applies to parties, receptions, celebrations, and other similar events. We believe that getting to those larger events should be postponed until after the current surge of COVID-19 transmission. Banquet facilities, rental halls, and houses of worship are required to continue to implement the implement all virus transmission prevention protocols and are advised to limit the number of people in attendance to ensure safe distancing. And this is also at weddings and funerals where possible. We want people to put off receptions and the like to avoid large groups from gathering. Residents are strongly advised not to conduct or attend any indoor gatherings with guests who are not members of their household. We said that from the beginning. And also, residents showing signs of COVID should shelter in place in their residence. That is to say, we've had an issue, frankly, for quite some time where people think it's just flu or cold, or they just think it's allergies, and they go about their business. And what we're finding now is that given the surge, it's likely COVID. And so you need to presume it's COVID and stay put. And so we want to reinforce that with this order. We know that a number of settings have decided to limit public interactions or decided to temporarily suspend business in order to prevent exposures. So these are listed in terms of employers and schools. We've strongly encouraged employers to work remotely and accommodate that. And we have said since the beginning, at the level in red, we've had advice since really September for the schools that we would recommend that they go remote if they're able to do so to avoid transmission. Some schools have chosen to be remote, some have chosen to be hybrid or full face-to-face for the five days, but a large number of them have chosen to go remote, and that of course is their prerogative through their school boards. So this is on our website, and the update will be the new version that's been passed will be on our website. But the idea is to get folks to recognize that they have the ability. It is a personal choice as to whether we're able to blunt the curve on this surge, and remind them of the types of events and settings that are contributing to the surge.
But again, it's all advisory. There aren't penalties, or there's not surveillance or anything like that accompanies this.
Right, it's an advisory as it was initially, and as it is across the urban counties. I believe about 60% of the population, actually, if we look at our urban counties in Franklin and Montgomery, in Lucas, and Hamilton. A number of these counties have extended their stay-at-home advisories in the same way as we have.
Okay, thanks.
Pete, this is a little bit like the seatbelts. Yes, there's penalties for seatbelts, but there how many times who gets tickets for not wearing a seatbelt? We count on people's personal responsibility. People are intelligent. People need to do the right thing for themselves and the rest of the community. We want people to stay at home whenever they can. That's protective of them and the rest of us. Yes, it's great that this vaccine is going out there. As soon as it's available, I'm going to grab it, but it won't be for months. Regular people like you, Pete, and me, and Terry aren't going to get the vaccine for months. We've got to continue to protect ourselves and others. Stay at home whenever you can.
Thanks.
Great. I think we have time for one more question. Okay, well, no problem. Thank you very much for your questions. That concludes today's briefing, and thank you very much. We wish you a safe and happy holiday season. Thanks so much. Take care.
Thank you.